Hi, it's Kim Hickey. I haven't done a blog in the last week. I'm sorry. I know I said I'd stay on top of it. But I've been a little busy discussing some of my experiences, trying to get the schools involved, some youth groups, and it's really starting to, um, progress is really starting to happen. The Endometriosis Foundation is going to start going into some of the schools here in Suffolk County. I am so happy. Finally, the word is going to be getting out here in Suffolk County, and I know that I had something to do with it. So I feel really good about spreading the word and trying to help people so they don't end up at my age in my situation. So I'm so happy that, as I wanted, the word is going to start getting out one way or another, whether it's through discussion or anything else. I do want to thank so many of you, my YouTube friends, for all the support and prayers that you have sent out to me and acknowledging that you didn't know what it was, never heard of it, and like I said, sending some really valuable advice as far as herbal treatments and just sending and spreading the love. I really appreciate it. I had a YouTube friend today ask me about Lupron, and I did try Lupron. I used Lupron. Um, After a couple of different treatments had failed, my doctor said Lupron would probably be the best treatment for me, along with Mirena, which is a 5-year birth control. And she said that the side effects were minimal. She never had anybody have problems with it. So I said, you know what? Instead of a hysterectomy, let's give it a shot. Um, the idea of Lupron is to kind of trick your body into thinking that it's in menopause. Um, but what I didn't know was the side effects that were going to affect me and make me so sick. When I say I was sick, I am not even close to joking. Um, Lupron is actually a very strong medication. It's used for prostate cancer, and they use it for females to lower the estrogen levels to trick your body into thinking it's in menopause. Um, so they use it as a short-term therapy treatment for endometriosis, and it's supposed to kind of put you in a remission for 5 years, is how they explain it. With me, my first month, like they said, all your symptoms get so much worse, and I was severe. I was curled up in a ball more than I think I ever could have been curled up in a ball. The pain was out of control. I was throwing up. I was not sleeping. I was losing my hair. Um, the second shot, the pain started getting a little bit better, but it was still there. I don't want to say it was gone, because it wasn't. Um, the side effects I was experiencing, I had like no appetite, but yet I was gaining weight. The hot flashes were worse than they are now that I had the hysterectomy and actually am in menopause. I wanted to roll around in the snow. That's like ridiculous. I was having really bad issues with my vision. My vision would kind of zone in and out and get really blurry, to the point where sometimes I felt like I was going to pass out, because it was really messing up my head, because I couldn't focus, and it was kind of scary. I was getting severe pains on the side of my head, and I continued to go through with it. And along with this, at the same time, I was on the Mirena. Okay, we did the first this at the same time. So the first shot was done at the same time the Mirena was implanted, and I started also getting severe pain um, in the vaginal area, and to the point where sometimes I couldn't walk. And I kept calling my doctor and saying, "Is this normal? Is this normal?" And she said, "Yes, you're going to feel a little discomfort," but it was more than discomfort. Um, Come the third month, I actually felt really good. Um, the pain was starting to alleviate a lot, but the symptoms from the Lupron were driving me crazy. So now I'm trying to weigh, okay, which one is worse? The pain that I'm in, or was in, for the last couple of years, or the side effects from the Lupron. And I eventually decided that I'd rather be in pain from the endometriosis than deal with the Lupron. At this visit, when I was deciding to stop the Lupron, the doctor had then recommended to me a hysterectomy. After some more testing and, just how bad the pain was, it just, there was really no way for me to live like that. So hysterectomy was recommended, and I couldn't have children anyway, I was told. So, and I was also told that hysterectomy would be a cure. So, at that point, just coming off the Lupron was so important to me because of all of the effects that it had on me, and I just needed to be able to live my life again. I had lost so much of my life because of endometriosis, and that's when I decided to do the hysterectomy. And like I said, I was told it was a cure, only to find out later that it wasn't. I have it now, it's growing on my colon, and I'm kind of in that position again where I'm searching for a doctor who knows how to treat this. I have seen a doctor, and they told me yes, it can continue after the hysterectomy, but gave me a blank face. They did not know how to treat it. So, would I recommend Lupron? Absolutely not. And if a doctor is telling you to try Lupron after a hysterectomy, there is no reason for it. The whole point of Lupron is to put you into a false menopause, and for any doctor to recommend Lupron after a hysterectomy, there's no reason. You're already in menopause. So as soon as they say that, your alerts should go off. This doctor does not know what they're talking about. Let me do some more research and find a different doctor. I had, made a suggestion, and I interviewed my doctors. I didn't let them interview me because, you know what, this is my body, this is my life. And after being steered wrong so many times with endometriosis, yeah, I learned the hard way, but you know what, now I'm in charge. And if you don't like that I'm asking you questions and how much you know about endometriosis, then you know what, you're not the doctor for me. Because I need to make sure that I'm safe. So the position that I'm in now with it being on my colon, I know there's a chance that I could eventually have to lose my colon. And that's not some way or where I want to go. So I'm going to research, and I am going to interview doctors until I turn blue. I don't care. If I have to wait and stay with the pain until I find the doctor that says, hey, yes, endometriosis can grow on your colon, this is what we need to do, I come home, I research it on my own and find that yes, it matches, or I contact the Endometriosis Foundation of America and ask them, and they agree, then I know I've found the right doctor. But until then, I'm just going to deal with it. I've dealt with it this long, and I'm not going to lose another organ or organs because I'm dealing with somebody who doesn't know what they're talking about. Um, Another thing is, with Lupron, it takes a while to come out of your system. Remember that this is supposed to be a 5-year treatment. Yes, it's only 6 shots, or 3 shots, depending on how strong of a dose you're getting. It shouldn't go longer than a 6-month period with the Lupron. Um, but it stays in your system for a long time. I can't tell you how long my hair was falling out for, how long I was vomiting for, how long I had no appetite. Um, my estrogen levels were just all over the place, and it was just, it was crazy. It was crazy. Um, Dealing with menopause now is so much easier than what I was dealing with during the Lupron treatment. And that right there just shows that this should not have ever been approved from the FDA for women with endometriosis. If they're using this as a treatment for prostate cancer, it's two totally different things. And, you know, I just really wish I would have read up on it a lot more instead of making that rash decision when my doctor said this is going to make you feel better. Because we tend to trust our doctors and just want to hear anything that they're going to say that's going to say, yes, it's going to make you feel better. But we need to stop, take a breath, think a little bit, come home, research it, and then make our decision. So before I say goodbye and end the blog on Lupron, I just want to go over some of the side effects of Lupron. Hot flashes, obviously, because it's meant to put you into that state of menopause. Night sweats, again, state of menopause. Heart palpitations, which I did have a lot of. A couple of times I actually got really scared and thought that I was having a heart attack. It was really, really bad. Not only just palpitations, but I had a lot of chest pain as well. Like I said, the dizziness that made me feel like I was going to faint and pass out. The rapid heartbeat, which just like going, it just keeps going and does not stop. Major headaches. I got major headaches as well. Like I said, I had the pain on the side of my head, but I also suffered from massive migraines on Lupron. Depression and nervousness. I experienced both of them. I was very, very nervous all the time. I contributed to feeling the heart pain, the headaches, the hair loss, the throwing up all the time. Never knew that nervousness was actually a side effect of the Lupron. Loss of libido, acne, and weight gain. I'm still trying to get the weight off from what I gained when I was on Lupron. It was horrible, horrible. So I just really want you to think twice if you're thinking about Lupron. And I want to thank you for watching my vlog. And remember, if you have any questions, anything, if you want to share your experience, please, leave a comment and share your experience with others who have gone through this. Because my experience is different than others, and, just everybody's input could help somebody else. So thank you again to everybody, and I'll talk to you soon.